Hi, it's Tugi talking. Today I'm going to talk about the ophthalmia neonatum. Ophthalmia neonatum is the inflammation of the conjunctiva that is present during the first month of life. It may be aseptic or septic. Aseptic neonatal conjunctivitis most often is chemical conjunctivitis that is induced by silver nitrate solution, which is used at birth for treats prophylaxis of infectious conjunctivitis, then later to be found to be toxic to the conjunctiva and causes inflammation. And septic conjunctivitis causes include bacterial and viral, which is chlamydia and Neisseria gonorrhea and herpes simplex virus and staphylococcus and streptococcus, etc. And about the clinical presentation and incubation period, chemical conjunctivitis secondary to silver nitrate solution application usually occurs in the first day of life, disappearing spontaneously in 2 to 4 days. And chronic conjunctivitis tends to occur 2 to 7 days after birth. And about the chlamydia, the incubation period is 5 to 14 days, and hepatic conjunctivitis usually occurs within the first 2 weeks after birth and has incubation period of approximately 6 to 14 days. And about the clinical presentation of the gonococcal conjunctivitis tends to be more severe than all the causes of ophthalmia neonatum. The basic presentation is severe bilateral purulent conjunctivitis, corneal involvement including diffuse epithelial edema, limbal ulceration, adjacent to severe conjunctival chemosis and diffuse opacification may progress to perforation of the cornea and endophthalmitis. And clinical presentation of chlamydial conjunctivitis may range from mild hyperemia with scant mucoid discharge to eyelid swelling, chemosis, and pseudomembrane formation. Blindness, although rare and much slower to develop than in gonococcal conjunctivitis, is generally not due to corneal involvement as gonococcal conjunctivitis do. Instead, eyelid scarring and conjunctival corneal panas can gradually progress to central corneal opacification by mechanisms reminiscent of trachoma. Follicular reaction does not occur because newborns have no requisite lymphoid tissue present in the conjunctiva. Clinical conjunctivitis of the herpes simplex virus conjunctivitis often presents in infants with generalized herpes simplex infections characterized by corneal epithelial involvement or vesicles on the periocular skin. Serious systemic complications such as encephalitis may also occur in these neonates owing to their poor immunologic response. And differential diagnosis should be made. Differential diagnosis should be exclude the other potential causes for acute red eye, such as preceptocellulitis or orbital cellulitis. Congenital dacry stenosis is another condition to consider in the differential diagnosis of neonatal conjunctivitis, etc. And diagnostic approach consideration should be made, which is conjunctival scraping for Gram and Ginza stain, and conjunctival scraping for PCR, and culture and histological diagnosis should be made. And about the treatment, specific treatment is available for each cause of neonatal conjunctivitis. Preliminary and presumptive treatment pending to culture permission should be based on the clinical picture and the findings on the Gram and Ginza and Papa Nicolau stains. Prior to birth, consider the risk of transmission of chlamydial, gonococcal, herpetic, and streptococcal pathogens to fetus during the vaginal delivery. To confirm the presence of STD in neonate, examine and treat the mother and her sexual partners. In treatment Prior to laboratory results should include the topical erythromycin ointment and intravenous or intramuscular third-generation cephalosporin. Prompt treatment of gonococcal conjunctivitis is important since this organism can penetrate and intact corneal epithelium and can rapidly cause corneal ulceration. Because of the rapid progression of gonococcal conjunctivitis, patients with acute neonatal conjunctivitis should be treated for gonococcal conjunctivitis until the culture results are available. The treatment is altered according to the laboratory result. And newborns with the conjunctivitis are at risk for secondary infections such as pneumonia, meningitis, and septicemia, which can lead to sepsis and death, thus should be admitted for full workup and treatment. Bacterial conjunctivitis rarely fails to respond to treatment. The treatment of the neonatal chemical conjunctivitis is not necessary. Lubrication with the artificial tear preparations may ease the mild and discomfort. Prognosis is generally good, can be associated with systemic involvement, and complications include corneal perforation and gonorrhea, pseudomonas. If we can't detect and differentiate the pseudomonas infection, it can lead to endophthalmitis and subsequently death. And chlamydia, 10 to 20% of the cases can lead to pneumonia. Herpes simplex virus can lead to corneal scarring and ulceration and sinus involvement. Thank you for your attention.